Just a couple of quick notes before we get started. Hopefully everybody received the email that I sent out a little while ago that included the slides and the handouts for tonight's presentation. If you did not receive it, please shoot me an email and let me know. Also, I will, as usual, be pausing during the presentation at the end of different sections to give people an opportunity to ask questions. And when I do pause for questions, you're welcome to either unmute and simply ask your question, or you're welcome to type your question into the chat box at any time, and I will address them when I do pause for questions. And I think that's it. Hopefully everybody can hear me all right. If you do have any issues with hearing me, please let me know by, again, either typing into the chat box or unmuting. And so with that, we will get started. So thank you for joining us tonight for part 2 of our 4-part Medicare 101 series. Tonight, we're going to talk about Medigap and Medicare Advantage plans in detail. We're going to start with who I work for, which is the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. And the mission of the Area Agency on Aging is to work with partner communities and governments within our 3-county region of Park, El Paso, and Teller to coordinate and develop systems that allow people to stay in their homes and in the community for as long as possible. I am the coordinator for the local SHIP office, which is the State Health Insurance Assistance Program. The SHIP program is a federally funded program that is designed to provide free and unbiased information and education on all things Medicare. So we do not sell or endorse any specific insurance products or companies, and we can provide information and education on all parts of Medicare, as well as all options of insurance to go with Medicare, including Part D, Advantage plans, and supplements. We also help people with limited or low income apply for financial assistance through those government programs. My SHIP office actually serves 9 counties in Colorado, and I've listed them on the slide. Every county in every state should have access to a SHIP counselor, at the very least by a statewide toll-free number. On this slide, I have listed both our local Colorado Springs number as well as our statewide toll-free number. By calling the statewide number, you would be routed to the SHIP office closest to whatever county or in whatever county you were calling from. So just a quick review of what we covered last week. Last week, we talked about eligibility for and enrollment in Medicare A and B. And then we talked about what Medicare A and B covers and what it costs. Original Medicare A and B, or A and B of Medicare, is considered, or also known as original Medicare. So tonight, again, we're going to talk about options for coverage to go with original Medicare. Medicare, when you have just original A and B of Medicare, you have basically 2 options of coverage that you can choose to enroll in to go with that Medicare. We're going to talk about both Medicare supplements, also known as Medigap. So Medicare supplement and Medigap are interchangeable terms for the same thing. And then we're going to talk about Medicare Advantage plans, sometimes also referred to as Medicare Part C. These 2 options of coverage are available to anybody who is actually enrolled in both Medicare A and B. Both of these options are regulated by the federal government and Medicare, and there are limited timeframes when you can enroll in these options, and we're going to talk about all of it. We are going to start with talking about Medicare supplements, or again, another term, Medigap. So what is Medigap? Medigap policies are basically private insurance policies that you purchase from private insurance companies, and they are solely and specifically designed to supplement the costs that Medicare Part A and Part B left over after they paid their part first, period. Let me repeat that. Medicare supplement policies, or Medigaps, are private insurance policies you purchase from private insurance companies, and they are solely and specifically designed to pay any balance that Medicare Part A or Part B left over after they paid their part first, period. So that is all these policies do. These kinds of plans do have to follow both federal and state laws that are designed to protect the consumer. If you purchase a Medigap or a Medicare supplement policy, that physical policy must actually say Medicare supplement insurance, those three words in that order to be a legitimate policy. The phrase Medigap comes from the thought process that this kind of policy is designed to cover the gaps in original Medicare, meaning the balances that Part A and Part B left over. There are several different levels of coverage to choose from when you are looking at Medigap coverage. They're labeled A through N. They're called plans instead of parts. So Medicare has parts, supplements have plans, with the exception of the 3 states listed who have a couple of additional options to choose from. And the cost for this kind of coverage does vary, not only from plan to plan, company to company. It varies from zip code to zip code. It varies between male and female. So there's all kinds of variables that can determine what a plan charges for any of, or what an insurance company charges for any of the plans that they offer as a Medicare supplement. So how it works. Medicare supplements, or Medigap, are only available to people who are enrolled in both A and B of Medicare. There are some situations where you may not need a Medigap. For example, if you are already enrolled in a Medicare Advantage plan, you cannot enroll in a Medigap as well. You can only do one or the other. Or if you have other creditable coverage, such as retired militaries, access to TRICARE for life, if you have a retirement health benefit option available through a past employer. I know para-retirees, federal retirees have some very good options for their retirees that coordinate with Medicare. If you have other coverage options that are going to be equal or sometimes even better than what you can purchase as a Medigap policy, I always encourage people to take advantage of those options. Many times, coverage available through past employers or as a government retiree are going to be better than what you can buy on this open market. When you enroll in a Medigap policy, it is secondary to Medicare. So original Medicare A and B are your primary insurance. And because original Medicare A and B are good with any doctor, hospital, or provider anywhere in this country and or our territories that accepts it, as long as Medicare pays their part first, the Medigap pays the balance. So for people who travel a lot or visit family in other parts of the country a lot, this is the most portable option because Medicare is good anywhere. And as long as Medicare pays their part, the Medigap pays the balance. Again, you must have and be enrolled in both A and B of Medicare. And then there are specific timeframes to be aware of to enroll in this kind of coverage. So when someone is initially enrolled in both A and B of Medicare, and what that means is, especially for people who worked past age 65, still had employer health coverage through that active employment, you may have enrolled in Part A, but until you enroll in Part B, this doesn't apply to you. So you have to be enrolled in both A and B, and when both of those are in effect, even if it's at different times, as soon as they're both in effect, Medicare has developed what they call a guarantee issue period into this kind of coverage. For people in Colorado specifically, and in many states, but not all states, we also provide a guarantee issue period to enroll in a Medigap policy for people who are on Medicare and under age 65. So they're usually on Medicare based on having been determined disabled by Social Security, and they qualify for Medicare based on that disability determination. Not every state provides this guarantee issue into a Medigap for people who are under 65. But if you are in that situation, you're under 65, and becoming eligible for Medicare, you get a guarantee issue opportunity when you first become eligible at any age, but then you also get another opportunity to get into a Medigap when you turn age 65. So what does that guarantee issue mean? Medicare supplement policies are allowed to underwrite. And what that means is they are allowed to ask you health questions. And based on those answers, there are many situations where they are allowed to decide whether or not they will sell you insurance based on your health history. A guarantee issue period means that for a short window of opportunity, insurance companies are not allowed to determine whether or not they'll sell you coverage based on health history. You're absolutely guaranteed to be able to purchase coverage of this sort during a guarantee issue period, regardless of any health issues. For Medicare purposes, a guarantee issue period is a 6-month window that starts from the time you have both A and B in effect. Even if it's at different times, as soon as you have both in effect, your 6-month clock starts ticking. And during that 6-month window, you can purchase any level of coverage from any company licensed in the state that you reside in, and nobody can turn you down for this kind of coverage for any reason whatsoever. Guaranteed issue policy. If for some reason you miss that window of opportunity, again, you can try and buy this kind of coverage, but you will have to answer the health questions, and insurance companies that sell this kind of coverage will be allowed to decide whether or not to sell you insurance based on the answers to those health questions. So if you are not healthy, if you have any pre-existing health concern, it is possible that you would be denied by an insurance company to purchase coverage outside of this guarantee issue window. So this guarantee issue window can be very, very important for people who have any sort of pre-existing health issue. Once this 6-month clock starts ticking, you cannot stop it. So if you don't purchase this level of coverage or this kind of coverage during that time frame, it would be very, very rare. And there are certain situations where it is possible that you might have another opportunity to have guarantee issue, and we will talk about those as we go. But it's not a guarantee. When you first get Medicare, you are guaranteed to be able to buy this kind of coverage if you choose to do so. So again, there may be some opportunities in the future if you don't use this 6-month window of guarantee issue to get into a supplement and you have pre-existing health issues. There may be future opportunities based on some very specific situations. So Medicare will provide you another window of opportunity to be guaranteed into this kind of coverage if you involuntarily lose other coverage that is considered creditable. So for example, if you are retired from a private employer, that private employer has offered healthcare coverage for their retirees that has been coordinating with Medicare, but suddenly that employer has decided to cut that coverage and drop it for all retirees. That would be considered an involuntary loss of coverage, and that would provide you with a guarantee issue window, a much smaller window, but a guarantee issue window that would allow you to get into a Medicare supplement policy without question. Other types of loss of coverage would be if you are actively employed and your employment ends and the employer active coverage ends. If you were employed, retired before you turned 65 and went on COBRA coverage. As soon as you are eligible for Medicare, COBRA coverage ends. That's a law. That's not your fault. It's considered involuntary loss of coverage. So those kinds of scenarios would provide you with an opportunity to be guaranteed issue into a Medicare supplement or Medigap. The most common way someone can be given an additional guarantee issue window would be usually involving an Advantage plan. So if someone enrolls in an Advantage plan, there may be a future opportunity to have guarantee issue into a supplement. We'll talk about that in more detail when we get to the Advantage Plan section. So we're not going to cover it too much here, but we will talk about it in detail. So again, what do Medigaps cover? They will only pay the balance after Medicare has paid any part for any sort of claim first. If Medicare denies a service, your supplement or Medigap will not pay anything either. It is only there to pick up the balance after Medicare pays first. So if Medicare does not pay first, it does not pay anything either. Other things that a Medigap does not cover are going to be other things that Medicare does not cover, basically. Long-term care, hearing or dental, vision, private duty nursing, and of course, outpatient prescription drugs, because that is now Medicare Part D, which we'll talk about in detail next week. But the bottom line is, if it's not a benefit of Medicare, it's not a benefit of a Medigap. If it's not a service Medicare approved and paid their part for first, it's not something that the Medigap will pay any part of either. So it's only designed to pay after Medicare pays first. In the email that I sent out earlier this afternoon, I included a couple of handouts regarding Medicare supplement policies in Colorado. The first handout is a document that is put together at the Division of Insurance. In Colorado, we are very, very fortunate that our Division of Insurance takes the time to put this document together. Not every state gets this. What they've done is they've reached out to every company licensed to sell this kind of insurance in the state of Colorado, and they have asked them what plans or what levels of coverage they sell. They've asked them to estimate or average what the monthly premium is for each plan with each company. So this is a very, very useful document that we will talk about in more detail in a minute. But again, we're very, very lucky that Colorado does this for us. The handout does say September of 2021. This is the most current handout. The information that the state gathers, they gather in basically this time of year. They spend the next 3 or 4 months getting this information. They produce this document, usually comes out midsummer, end of summer, and it's good until the following year. So this is the most current document, even though it says 2021. The other handout that I sent you about Medicare supplements is this chart. And it says the 2022 standardized Medicare supplement plans. This chart is going to explain to you the levels of coverage you have to choose from to purchase as a Medicare supplement. So there are many companies you can buy this coverage from, but Medicare has standardized what you can buy. And they have standardized it into basically 10 levels of coverage. And these levels of coverage are set in stone, meaning any company you buy any of these levels of coverage from are all selling you the exact same thing. So we'll go over this chart briefly, basically so that you understand what it's telling you. Again, I mentioned supplement plans are labeled A through N, like the alphabet, and they're called plans. So the plan A, plan B, plan C, not to be confused with Medicare parts, such as Part A and Part B. These are supplement plans. So we've got Plan A, Plan B. I'm going to skip to D, G, F, K, L, and M. Each one of these plans provides a different amount of coverage to go with Medicare, or amount of coverage that pays after Medicare. For example, Supplement Plan A. Under Supplement Plan A, it lists only basic benefits. And what that means is if you buy a Supplement Plan A, the only coverage you're buying is it will pick up the 20% for Part B services that Medicare left over after they paid first. And that's all it will cover, is just the 20% for Part B services. We go to Plan B supplement. It pays the 20% for Part B services, but it also covers your inpatient hospital deductible every time you're admitted. Again, the hospital deductible for 2022 is $1,556 per admission. Plan B or higher pays that deductible for you every time. I'm going to skip to Plan D. Plan D covers the basic benefit, the 20% for Part B services that Medicare left over, covers the Part A hospital deductible every time you're admitted. It also includes the skilled nursing facility coinsurance benefit. So if you remember from last week, if you have a qualifying hospital stay of 3 days or longer, and then you're discharged into a skilled facility for rehab or recovery, Medicare pays the first 20 days of that stay at 100%. And then starting at day 21, Medicare continues to pay everything except for a daily coinsurance. For 2022, that daily coinsurance is $195.50. If you have a supplement plan D or higher, that supplement will pay that $195.50 for you for every day past day 20 that you're in that skilled facility. Plan D also includes, at the very bottom there, a foreign travel emergency. I'm not going to say benefit, but a reimbursement, basically. The way the foreign travel emergency benefit works with any supplement that includes it. And again, I hesitate to call it a benefit because it's not really a benefit, it's more of a reimbursement. The way it works is if you are out of the country, you're traveling in a foreign country where Medicare does not work at all. Medicare, again, stops at the border. If you are in a foreign country and you experience a medical emergency, basically you have to pay for that emergency while you're in that foreign country. When you get back home, you can submit the receipt for that emergency to the supplement for reimbursement. They're going to turn around and send it back and tell you to bill Medicare first for a denial. So then you take that receipt and you bill Medicare, and Medicare is going to deny that claim because it was services received outside of the country. You're going to take that receipt and that Medicare denial, resubmit it to your supplement, and they are going to reimburse you 80% of the cost of that emergency after a $250 deductible. So it's not insurance coverage when you're out of the country, but it can be reimbursement of the cost of any medical emergency you have. And that's how it works with any of the plans, and about half the plans do include that benefit. So that's the benefits under Plan D supplement, the 20% for Part B, the skilled nursing facility coinsurance, the Part A deductible, and it has that foreign travel emergency clause. Skip to Plan G. Plan G covers everything that a Plan D covers. It also includes a benefit called Part B excess. Part B excess is basically explaining how doctors get paid by Medicare. So when you have original Medicare as your primary insurance, there are two ways doctors can accept Medicare payment. The first way a doctor can accept payment is based on accepting Medicare Assignment. What that means is that Medicare provider is willing to accept whatever dollar amount Medicare assigns for whatever service they're providing to you as payment in full. So for example, say you have a regularly scheduled appointment with your primary doctor. You go to that doctor's appointment. That doctor, if you had no insurance, would charge you $300 cash, but you have Medicare. So that doctor is going to bill Medicare for that appointment, going to bill Medicare $300. Medicare is going to turn around and say, this service, this type of service is worth $100. And they're going to pay 80% of that. So Medicare is going to cut that $300 bill down to $100. They're going to pay 80% of $100. The other 20% is going to go to your supplement, and under basic benefits, they're going to pay the other 20% or $20. The doctor is going to get paid a total of $100. That doctor accepts assignment. So he accepts that dollar amount as payment in full. The other $200 of that $300 that he originally billed to Medicare goes away as if it never existed. He cannot bill you anything above and beyond what Medicare assigned for that service. Then there's doctors who don't take assignment. And it basically works the same way. You go in for an appointment, that doctor is going to bill Medicare $300. Medicare is going to turn around and say it's only worth $100, pay 80% of the $100. Send it to the supplement will pay the other 20% of the $100. However, when a doctor does not accept assignment, that doctor is allowed to charge you, the patient, 15% above and beyond what Medicare assigns for that service. Keep in mind that Medicare already has a predetermined dollar amount assigned to any and every service that you could ever receive from any provider. So doctors know what Medicare is going to assign for any service that they provide. And he calculates 15% above that. That doctor is probably going to ask you to pay $115 before you leave the office. The reason he's going to do that is because even though he's required by law to bill Medicare for you for that service, when Medicare gets his bill, Medicare is going to see that that doctor does not take assignment, and Medicare is going to assume that you paid that doctor $115 already. So when Medicare processes that claim and pays 80%, they're going to send you a check for $80. They're going to send it to the supplement's going to do their part. They're going to send you a check for $20. If you have that additional Part B excess coverage through your supplement, the supplement will also reimburse you the extra 15%, or in this example, $15 that you paid up front, so that you are reimbursed everything that you paid at that unassigned doctor's visit. Plan G is the only plan that offers that benefit. We go over to Plan K and L, and you'll notice that both plans K and L cover Part B benefits, basic benefits, but they only cover them at 50% or 75%. Go down to skilled care, they cover 50% or 75% of that skilled care coinsurance. They only cover 50% or 75% of that Part A deductible. Because those plans do not pay 100% after Medicare, they do have maximum out-of-pocket limits, so that if Medicare pays their part, the supplement pays their part, and you end up paying the other 50 or 25% left over, and you pay in those amounts up to that maximum out-of-pocket limit for the year, then that plan would have to start paying 100% for the rest of the year. Then January 1st, it would start all over. Because those plans pay only percentages of what Medicare left over, the premiums for those plans can be much lower. Go to Plan M. It covers 100% for the basic Part B benefits, covers 100% for skilled nursing facility coinsurance, but it only pays 50% of your hospital deductible. However, it does include the foreign travel emergency benefit. Plan N is becoming very popular. Plan N does pay 100% for most Part B basic benefits, but it does apply a $20 copay to any sort of office visit, or a $50 copay to any ER visit. Any other benefits that you receive under Part B would be paid at 100% after Medicare. Pays 100% for skilled facility, pays 100% of your hospital deductible, has the foreign travel emergency benefit. Those are the types or the different levels of coverage you have to choose from as a Medicare supplement, and you can pick from any of those levels of coverage. Now, I skipped over Plan C and Plan F, and they're in gray shaded boxes because those plans are no longer an option to purchase for people who become eligible for Medicare anytime after January 1st of 2020. If you were eligible for Medicare, regardless of whether or not you enrolled, but if you were eligible for Medicare prior to January 1st of 2020, you would still have the option of looking at purchasing Plan C or Plan F. The only difference between C and F and any of these other plans that we just talked about is that both Plan C and Plan F, in addition to the other benefits, also covered the Medicare Part B annual deductible. The reason these plans are no longer available for purchase to people who became eligible for Medicare after 2020 is because they paid the Part B annual deductible. and the government decided that was considered first dollar coverage, and it was too good a coverage. And so they have made it so they're no longer available, because basically if you could purchase the Plan F, it covered 100% after Medicare. You basically had 100% medical coverage with no out-of-pocket costs. But again, the government has decided that not having any out-of-pocket costs is too good for us. And so those two plans are no longer an option for most people. But again, if you were eligible for Medicare prior to 2020, you can still look at purchasing those plans. So again, these are the plans you have to choose from. These plans are set in stone, meaning any company that you look at purchasing a Plan G from, it's going to be the same Plan G. Every company is going to sell you the same Plan G. A Plan G is a Plan G is a Plan G, no matter who you buy it from. But for that reason, it pays to shop around, because there's absolutely no advantage to paying a higher premium for a Plan G from company X when company Y sells the same Plan G for a lower premium. They're all selling you the exact same plans based on this chart. So we go back to the other handout, the first handout I talked about, that the Division of Insurance puts together for us. The purpose of this handout is not to tell you what you're going to pay in premiums. It's to give you an idea of what the premiums look like and to kind of help you understand what companies charge higher premiums, what companies charge lower premiums, and to show you which plans each company sells. For an insurance company to be considered a Medicare supplement company, they are absolutely required to sell Plan A, but that is the only plan they're required to sell. They can pick and choose from any of the other plan options that they want to sell. You'll notice that most of the columns for F, G, and N have amounts in them. Basically, those are going to be the three most popular plans being sold right now. When you look at this handout, it's going to be, when you get to this section, which is about halfway through the handout, it's going to be broken up into age groups. So the first page of these charts is going to say age 65 at the top, and that's going to be the age group of 65 to 69. Along the left-hand side, you're going to see a list of companies. These are alphabetically ordered, and they're listed front to back of each page. So when it's front and back or 2 pages electronically in alphabetical order. That means there are over 40 companies licensed to sell this kind of coverage in Colorado alone. Across the top, it says A through N, just like the chart we just looked at. If you intersect company X with, say, G, where those two meet in the middle, if there is a number in that box, that number represents an approximate monthly premium for that plan with that company. You'll notice that it's also broken up between male and female. Women tend to pay slightly lower monthly premiums for this kind of coverage because statistically we tend to take better care of ourselves. Men pay slightly higher. There are other factors, again, that come into play with the costs. Prices can vary from county to county or zip code to zip code. They will certainly vary from plan to plan. Again, this handout is not designed to tell you exactly what a premium will be if you call this company. It's designed to help you sort out the companies that you might want to call. So it's going to show you what companies charge more for the same Plan G and what companies charge less. And it's going to help you weed out companies that you would not want to be in contact with. Again, Plan A is required. Plan G is basically currently considered the Cadillac of coverage for this kind of insurance right now. And then Plan N has become very, very popular because it is a little bit lower in premium based on the fact that you have copays for a couple of services. This is going to probably be your best tool if you're looking at buying this kind of insurance to go with your Medicare, because it will help you narrow down the companies that you consider, first of all, as well as give you an idea of what prices look like. Also gives you the plans or the insurance company's contact information. You do have to purchase this kind of coverage directly through the plan or the insurance, because again, it's private policy from a private company. They do not contract directly with Medicare. You must contact them directly to get more information or to enroll in their plans. And I think I will pause there for questions. Again, if you have a question, you're welcome to unmute or type your question into the chat box. No questions? Did I mention there's a test at the end? Just kidding. All right. All right. So if there's no questions, we will move on. So that was Medicare supplements or Medigap policies in a nutshell. Now we're going to talk about Medicare Advantage plans. And this is where it gets really confusing. So Medicare Advantage plans are the other option you have for coverage to go with Medicare on the basically open market. But they are an entirely different animal from Medicare supplements. I'll pause real quick because I do have a question pop up about supplements in the chat box. If I sign up for a plan but decide I should have chosen another, can I change? Actually, this is a good question. So I mentioned earlier that when you first enroll in Medicare, you have that 6-month window of guarantee option where no company can turn you down if you have pre-existing health issues. Medicare supplements do not have annual enrollment periods. That's one of the reasons they're allowed to underwrite. Whether you purchase a supplement during that 6-month window of guarantee issue or not, you have the ability to apply for this kind of coverage at any time for any reason. The key to that is whether or not you're going to pass underwriting outside of a guarantee issue period. Because these companies can ask you health questions, although you'll never have to take a physical. They're always allowed to ask you health questions, and they can determine based on those answers whether or not they want to sell you insurance, and they are allowed to turn you down. And it's typically going to be an all or nothing scenario. It's not that they'll take you, but you'll have to pay higher premiums. It's going to be usually they'll take you or they won't. So as long as you're healthy or healthy enough to pass underwriting with any company, you can purchase this kind of coverage, change this coverage, change your level of plan at any time. There's no enrollment period outside of that first 6 months. There's no annual opportunity to change this coverage. Usually once you're in, you're in. If you have pre-existing health issues, once you're out, you could be out. So if you're healthy enough to answer the question, if you're healthy enough to pass underwriting, yeah, you can look at other plans or other companies and apply for those. And if you're healthy, you're likely to be able to purchase them. If you're not healthy, not so much. You may not have the ability to switch to a different company or a different plan if you have any pre-existing health issues because of that underwriting, and you may be stuck with the plan that you purchased. So hopefully that answers that question. And we'll talk a little bit more about that when I explain a little bit more about the Advantage plans. So Advantage plans, again, an entirely different animal when it comes to type of insurance or coverage to go with Medicare. In a Medicare Advantage plan, when you enroll in that plan is a private insurance company, but that plan and that company have contracted directly with Medicare. Supplements do not, but Medicare Advantage plans do contract directly with Medicare to provide Medicare coverage and services on behalf of Medicare. When you enroll an Advantage plan, that plan basically replaces your original Medicare, because now Medicare is going to pay that plan or that insurance company to provide all your Medicare covered services through that private plan. You still have original Medicare, you still have to pay your Medicare premium. Original Medicare never goes away. It just goes into the background once you enroll in an Advantage plan. And for that reason, sometimes Advantage plans are referred to as replacement plans. You will still always have all your rights and protections of original Medicare. You'll still have access to all the services that regular Medicare pays for. But these are called Advantage plans for a reason. And that's typically because these plans are able to offer additional benefits above and beyond what Medicare provides, original Medicare provides. And usually they will include Part D coverage at no extra cost. Medicare supplements do not include Part D. You have to purchase Part D plan in addition to Medicare and the supplement if you want drug coverage. With Advantage plans, Part D is typically rolled up into that package of the Advantage plan so that it's all in one. So who can have an Advantage plan? Basically, again, anybody who is enrolled in both Parts A and B of Medicare can enroll in an Advantage plan. However, there's some additional requirements. You must live in the plan service area. Basically, what that means is you can only purchase an Advantage plan that's available in the county that you live in. So if you live in El Paso County, you have a wide array of plans to choose from, but you have to choose a plan that's available for sale in that county. There are enrollment periods for Advantage plans. Basically, once you're enrolled in both A and B of Medicare, you get an initial enrollment period. But then there's also other enrollment periods, annual enrollment periods that we'll talk about in detail. So again, initial enrollment period, that's going to be based on when you originally get A and B of Medicare, whether that's based on initial eligibility of turning 65 in that 7-month window of 3 months before your birthday, the month of, and 3 months after your birthday. Anytime during that 7-month window that you are enrolled in Medicare, you can enroll in an Advantage plan. Once you're enrolled, or if you don't enroll during that initial enrollment window, you would still have an annual opportunity to enroll in an Advantage plan. Actually, you have a couple of them. So the first opportunity would be the annual election period, what we refer to typically as just open enrollment. And that's the enrollment period that is October 15th through December 7th every year. Medicare has also reinitiated the annual Medicare Advantage plan open enrollment period. And then, as typical with Medicare, there are always special opportunities to do things or to get coverage outside of these regular enrollment periods. So again, the annual election period or open enrollment is every year, October 15th through December 7th. Any plan change or choice that you make during that October 15th through December 7th window goes into effect January 1st of next year. During this enrollment period, you are able to either get into or get out of or switch from one to another Advantage plan or Part D plan without restriction. So if you've never been in an Advantage plan, you can get into one. If you've been in one and you want out, you can get out of one, or you can simply switch from one plan choice to another during this window. And again, any change you make during that time frame automatically goes into effect January 1st of next year. The newest enrollment period Medicare has initiated is the Medicare Advantage open enrollment period. This enrollment period is only for people who, as of January 1st of any year, are actually enrolled in an Advantage plan. If you are enrolled in an Advantage plan on January 1st of any year, you have an additional opportunity to either switch to a different Advantage plan or to get out of an Advantage plan and go back to original Medicare and a separate Part D coverage. If you are not enrolled in an Advantage plan on January 1st, this enrollment period does not apply to you. But this is an additional opportunity for people who have Advantage plans as of January 1st to either switch to a different plan or get out of Advantage plans altogether. Again, this is a 3-month window, so it's an extended amount of time for people to make this change, January 1st through March 31st each year. And whatever change you make in whatever month during that time frame you make it goes into effect the first day of the following month. And then you have that that plan, whatever you chose to do, until the following year. And then there are special enrollment periods. Special enrollment periods are with Medicare usually always going to be involving some sort of other involuntary loss of coverage. So anytime Medicare is giving you a special opportunity to make a plan change or to get into coverage, it's primarily going to be based on the fact that you've lost other coverage involuntarily. With Advantage plans, because you are required to buy a plan in the county that you live in. So you have to buy a plan that's available for sale in the county you live in. If you move out of that county, you cannot take your plan with you. You have to leave it behind in the county you're moving out of. Because you cannot take it with you and that's not your fault, that is considered involuntary loss of coverage. Another way that could happen is if you're in a plan, you're in an Advantage plan, and suddenly that plan has decided they no longer want to sell coverage in that county and they leave that county. Again, that's considered involuntary loss because it's not your fault they're leaving. And that provides you an opportunity to enroll in something else. Same with involuntarily losing, say, retirement employee coverage and those other opportunities of involuntary loss that we talked about a little while ago. Again, any sort of involuntary loss of other coverage will typically create a special opportunity to get into any of the other options Medicare may offer, including the Medicare supplements and the Advantage plans. Another way an Advantage plan might be able to give you a special enrollment is through what they call a test drive. A Medicare Advantage test drive or trial right is a provision that Medicare has added because there is so much confusion surrounding how Medicare Advantage plans work, what they do, how they do it. So what Medicare has provided is a test drive opportunity, and there's two ways someone can use it. If you become eligible and enrolled in original A and B of Medicare, when you first turn 65 and you go straight into an Advantage plan, you decide that's what you want, you enroll in it right away. Medicare is going to give you 12 months to try out that Advantage plan. If at any time within that 12 months you decide that you don't like that kind of coverage, Medicare will let you get out of that plan, no matter what time of year it is, and still have guarantee issue into a supplement. So this test drive in this situation does coincide with the 6 months of guarantee issue that Medicare gives you into a supplement anyways, but it can potentially extend that 6 months into almost 12 months of guarantee issue into a supplement if you choose to enroll in an Advantage plan first. This is called the 65 SEP or special enrollment period, and it only applies if you enroll in Medicare at 65 and enroll immediately into an Advantage plan. You get 12 months to try it out. If you don't like it, you can get out and still have guarantee into a supplement, even if it's past your 6 months of guarantee issue. If you stay in the Advantage plan for even 12 months and 1 day, you lose your test drive. It's expired. The other way you can take advantage of a test drive is if you enroll in original A and B of Medicare and immediately enroll into, or anytime during the first 6 months of guarantee issue, you enroll into a Medicare supplement. If you maintain that Medicare supplement without any break in coverage for a year, 2 years, doesn't matter. As long as there's no break in coverage and you decide at any year down the road during an annual enrollment period that you want to try an Advantage plan, Medicare will allow you to drop your supplement, enroll in the Advantage plan during the open enrollment period, and let you try out that Advantage plan for 12 months. If at any point during that 12-month period you decide that's not the coverage for you, you want back into your supplement, Medicare guarantees you back into the supplement you left. If you go longer than 12 months in that Advantage plan, you have no guarantee back into your supplement without underwriting. But again, you have to maintain supplement insurance coverage without any breakthrough coverage for however long you have it before you can take advantage of a test drive in that regards. So those are all of the opportunities you have to not only get into an Advantage plan, but an opportunity to get into one to try it out to see if it works for you. And if it doesn't work for you, you potentially have an opportunity to get back into or get Medicare supplement coverage. Any questions about any of that? Now that's a lot to absorb and it's a little confusing, but if anybody has any questions, I'll take them. Okay, no questions. So that's the ways you can get into an Advantage plan or get out of an Advantage plan. So let's talk about how Advantage plans work and how that is different from the way original Medicare with a supplement works. Again, totally different kind of animal for coverage. In an Advantage plan, you still have to pay your Part B premium. And we'll talk about the Part B payback benefit that you might see advertised on TV in a minute. You may also have an additional monthly premium for the Advantage plan. However, I can tell you in Colorado Springs, in El Paso County, there are many, many plans that have 0 monthly premium, as long as you're paying your Part B premium. But with Advantage plans, you are going to have out-of-pocket costs. So in exchange for that lower or no monthly premium, you will probably have an out-of-pocket cost for almost every service you receive while you're in the Advantage plan. Again, these plans are required to provide all Medicare covered services, but they're provided through that plan directly. These plans can include prescription drug coverage, the Medicare Part D, already included in the package instead of having to buy it separately. Not all plans include Part D, but most of them do. In an Advantage plan, you may have the limitation of who you can see and where you can go for care. So a lot of Advantage plans are HMOs. You have to stay in the network of providers, with the exception of having a medical emergency, no matter where you're at. So if you have an Advantage plan and you're visiting family up in Denver, you're out of network for the plan. But if you have a medical emergency, that plan has to cover that emergency no matter where you're at in the country. An Advantage plan, the cost sharing will be entirely different than it is with original Medicare. And then just to make it a little more interesting, there are many, many different kinds of Advantage plans to choose from. You've got HMOs, health maintenance organizations, PPOs, private fee-for-service plans, special needs plans. We've also got Medicare savings accounts, cost plans that are actually been sunsetted at this point, PACE programs. To find out what plans are available in Colorado or what plans are available in the area that you live in Colorado. One way to do that, to get all that information in one shot, is to call up 1-800-Medicare and request that they send you a Medicare new handbook specific to Colorado. In the back of that handbook, it does list all the Advantage plans available in the state of Colorado based on area, region, or county. And again, you can order that physical paperback handbook by calling 1-800-Medicare. The only other way you're going to find that information all in one place is to go to Medicare.gov. At Medicare.gov, there is a search engine within that website. And that search engine allows you to put in, say, all of your specific medication needs, your preferences, your pharmacy preferences, and it will show you all the plans available in the zip code that you live in. Medicare Advantage plans vary from county to county. So that's why it's important that you buy one available in the county you live in, and you can't take it with you when you leave that county and make a permanent change of address. And every county will have different plans to choose from. So in Colorado, some counties have 2 or 3 plans, Advantage plans to choose from. Other counties may have 20 or 30 plans to choose from. By going to the Medicare.gov website and using that search engine that's simply called Find Plans, it will show you exactly which plans are available in your specific zip code. Other plans that might be available but currently aren't available in Colorado are Medicare savings accounts, which are very much like health savings accounts. But again, none are available for purchase in Colorado. Colorado used to have cost plans, which were basically like HMOs, but those have been sunsetted and are no longer available for purchase. There are currently not any demonstration or pilot programs running in Colorado, but Colorado does have PACE programs, or programs for all-inclusive care of the elderly. And we're going to talk about each kind of plan in more detail. So, Medicare Advantage HMO plans. Basically, if you've ever had HMO for health insurance coverage, you know what I mean when I say an HMO is an HMO is an HMO. They all work exactly the same way. HMOs have very restrictive rules. So basically, you are required to have a primary care provider. You must use providers and facilities that are within the network of that HMO. So basically, you have to go to whatever providers or facilities that HMO has contracted with in your county. You are required to get a referral to see specialists. You may be required to get prior authorization for some services. If you try and get services outside of the county or network of that HMO, you're going to have to pay for that service out of pocket, because neither Medicare nor the HMO will pay for any services received outside of the plan's network. With the exception, of course, emergency services, which I just talked about. Most HMOs include Medicare Part D, already included in the package, so you wouldn't have to purchase that separately. Medicare PPOs, or preferred provider organizations, are a little more flexible. If you enroll in a PPO, that PPO plan does have a network of providers they would prefer you use. And if you use their contracted network of providers, you will pay lower copays. But in a PPO, you're allowed to go out of network. As long as you can find a provider willing to take your insurance, whatever they pay and your copay as payment in full, you can go to any provider you want. If you go to a provider out of network, you are going to pay higher copays. But because you're allowed to go out of network, referrals are not required to see specialists, although you may still be required to get prior authorization for some services. Copay amounts are still determined by the plan, so whatever provider you use out of network, again, has to be willing to accept that as payment in full. PPO plans may or may not come with Part D coverage. If you get into a PPO plan that does not include drug coverage, you would not be able to get drug coverage outside of that plan. So you would want to have a good reason for not needing Part D coverage if you enrolled in a PPO that didn't include it. For example, if you were a veteran and accessed the VA pharmacy, you would not need to Part D through Medicare, and you can enroll in a PPO that didn't include drug coverage. Medicare fee-for-service Advantage plans are designed to be the most flexible Advantage plan. And originally, they did not have a network of providers you are required to use. Unfortunately, when they first became available for purchase, there were a lot of insurance agents out there selling these kinds of plans in counties where no doctor would take them. And so people were not even able to find a provider in the county they lived in. So Medicare had changed the rules a little bit, and now fee-for-service Advantage plans are required to contract with at least one provider in every county that they're sold in. But other than that, you can go to any doctor, provider, or facility who's willing to take that plan without question. But it does become your responsibility to make sure that whatever provider you want to use is willing to take your insurance as payment. Because there is no network, no referrals are required, although you may still be required to get prior authorization for some services. What you pay in copays is still determined by the plan. With these plans, they may or may not come with Part D drug coverage, but with a fee-for-service plan, if it does not include Part D coverage, you are allowed to buy a separate Part D plan so that you have drug coverage. The most important thing to know about fee-for-service plans is that because there is no contract, there's no network of contracted providers with this plan. If you find a provider willing to take you and your insurance one day, that provider can decide they don't want to take you the next day. They're not obligated to do so. They can choose not to see you at any time. So that is something to be aware of. Otherwise, you would be able to use this plan basically anywhere you want, anywhere in the country, theoretically. Special needs Medicare Advantage plans are going to be basically HMO type Advantage plans, but geared to very specific populations, specifically people who are Medicare and Medicaid, or people who live in long-term care facilities, or people who have multiple qualifying chronic health conditions would be eligible to enroll in a special needs plan. Special needs plans are not available in all parts of Colorado. Again, you can either get the Medicare New Handbook, you can go to medicare.gov and use their search engine to find what plans, if any, are available in your zip code. You can always call 1-800-Medicare and they'll help you look that information up as well. Again, Medicare cost plans have been sunsetted, so we're not going to talk about those. We do have PACE programs in Colorado, and they're growing in popularity. A PACE program is basically a type of Medicare Advantage plan, but it is specifically designed for people who are on Medicare and long-term care Medicaid or eligible for long-term care Medicaid. And basically is going to be like a Medicare HMO on steroids, because it really takes that HMO, that health maintenance organization philosophy, to heart. In a PACE program, if someone is eligible to enroll, that program is designed to provide more intense case management to help keep that person in their homes in the community versus going to a long-term care facility or assisted living. So it's going to provide more intense case management. It's going to provide medication management. It may provide transportation to medical appointments. May provide socialization opportunities, all of those kinds of things. So basically it's an HMO. You still have to use the providers that that plan contracts with, but because that person is Medicare and Medicaid, there are no out-of-pocket costs associated with it, and it always includes a drug benefit. So those are the different kinds of Advantage plans you have to choose from. If you enroll in an Advantage plan, you absolutely still have rights. You have the right to access healthcare providers. So that plan is absolutely responsible for making sure that there are providers you can use while you're enrolled in that plan. You do have the right to know how those plan doctors get paid. You always have the right, both in Medicare and in an Advantage plan, to fair, efficient, and timely appeal processes and fast appeal processes in certain situations. You always absolutely have the right to get the healthcare services that you need. You have the right to get any information about your plan or services in easy to understand language. And of course, you always have the right to have your healthcare information kept private and personal. When it comes to Medicare Advantage plans, and honestly, Medicare drug plans, Part D plans, Medicare has unfortunately had to come up with a lot of rules when it comes to marketing these plans. So there are a lot of do's and don'ts that insurance agents have to abide by when it comes to how they sell these plans to you. A lot of these things are don'ts, because unfortunately a lot of these don'ts have happened. So when someone is looking to try and sell you a Medicare Advantage plans, the things that agents or brokers cannot do is they cannot approach you in common areas, parking lots, sidewalks, lobbies, hallways, doctor's offices, waiting rooms. They are not allowed to send you unsolicited text messages or make unsolicited calls, cold calling. Now they can send you junk mail, either hard copy through the snail mail or by email. That is something they're allowed to do, but emails must have an opt-out option, so you can choose not to continue to receive their junk mail. Agents and brokers are not ever allowed to use the term free when they're describing any zero premium advantage plan. As we all know, there is no such thing as free, and free is absolutely different than zero premium. They cannot require anybody who is interested in attending any marketing or educational event to sign in. So if they've advertised that they're going to be doing a Medicare 101 at the senior center next week, when you show up for that 101, that free presentation, they cannot require that you put your name and number anywhere or write it down. You don't have to sign in because that's considered harvesting. And because they are not allowed to cold call people, there's no reason they would need that information. And they're not allowed to camp out in doctor's offices or waiting rooms and pharmacies. Now, can they have a table set up outside of a pharmacy if the pharmacy allows it, but they cannot approach you in a pharmacy or a doctor's office. Agents and brokers and companies are not allowed to misrepresent themselves to a beneficiary. So they're not allowed to say things like, we're Medicare approved, or I'm with Medicare, or Medicare sent me. Can't say stuff like that. Agents can conduct both marketing events, sales events, and educational events. And unfortunately, this particular topic has gotten a little gray in as far as what they can and cannot do. They cannot do a marketing event and an educational event at the same time, or one right after the other. However, if they're doing a marketing event, they can have a marketing table. If they're doing an educational event, they are allowed to have a marketing table right outside of that event that you can approach after you're done with the educational presentation. That not used to be an option. They used to have each one of those events separated by days, much less by locations. But now they can have a sales table right outside an educational event. And again, they can't approach you, but you can approach them for more information. During an educational event, they're not allowed to talk about whatever product they sell. They're only allowed to provide you general Medicare information or general plan information like I'm doing here today. They're not allowed to talk about whatever specific product or company they work for. They're not allowed to provide meals at any marketing or sales event, so they can't offer to buy you dinner. They can provide light refreshments, but I know in the past, many people got postcards in the mail that says, show up for this marketing event at King's Table and dinner's on us. That's no longer allowed. And these agents and brokers are absolutely never, ever, ever allowed to go door to door. So unfortunately, we had situations where someone would get into a secure senior apartment complex and just start putting, flyers on everybody's doorknob or knocking on everybody's door to try and to talk to people and sell them whatever they're selling. That was an issue, not allowed to happen. They are not allowed to go door to door. They are not allowed to cold call you. The only reason any of these companies or agents would call you is if either you called and asked them to call you, or the other way they can do it is if you've ever had any affiliation with the insurance company that they work for, and your name is in their system for some reason, they are allowed to call you. But if you've never had any affiliation with an insurance company and they cold call you, that is not allowed. So lots and lots of rules that you should be aware of. I did include a couple of handouts that gave you more information about what can and cannot happen and what should and should not happen. And I would strongly, strongly encourage you that if you ever witness any of these cannot things happen, please call us or call Medicare at 1-800-Medicare or call, and I'll have some numbers at the end of the presentation, call the Division of Insurance, call somebody if you witness any of these things that should not be happening, and let somebody know. Because if you don't let somebody know, those things will continue to happen. And ultimately that does result in people being talked into plans that are not appropriate for them, being pressured into buying things that are not appropriate for them. And it's just not a good thing to happen. So we're always happy to talk to somebody who may have witnessed or experienced any of these cannot do's. And we're always happy to help them report that to Medicare if nothing else. A couple of other quick notes. I've already mentioned things that they cannot do. There are things that they have to do. Any marketing material that any company puts out to the public has to be approved by Medicare. These companies are absolutely supposed to comply with do not call registries. A lot of people say those registries don't work very well, but they are required to comply with them. They're always required to obtain permission to contact you. Again, that goes back to no cold calling. And then if you do make an appointment to talk to somebody about whatever they're selling, keep in mind that they're supposed to have you sign or at least give verbal consent to what's called a scope of appointment. And that details what they are and are not allowed to talk to you about during that appointment. Again, I did provide additional information in the handouts that I sent you that will hopefully be helpful if you choose to look at this kind of insurance option and decide to talk to a marketing agent or broker. So read through that information if you can, and just be aware of those things. And again, please let us know if you happen to witness any of the things that should not be happening. Okay, so that is pretty much Advantage plans in a nutshell. If you're thinking or leaning towards this kind of coverage, a couple of questions I would suggest you ask yourself before you sign on the dotted line. If you're looking at a plan that includes Part D coverage, and again, we'll talk about Part D in more detail next week, but make sure that plan covers your drugs. Every plan, whether it's drug coverage through an Advantage plan or whether it's through a Part D standalone drug benefit, every plan available has a different list of drugs they cover. So you can never just assume your drugs will be covered because they all cover a different list of drugs. So make sure that whoever you talk to looks up all the drugs that you take and that they're covered under the plan. If you have providers that you want to continue to see or use, if you're looking at Advantage plans, ask those providers if they participate with those plans. If you enroll in an Advantage plan and that provider that you want to keep is not participating with that plan, you would have to find another provider. You wouldn't be able to continue to see the one you wanted. If you have a hospital preference, I know in Colorado Springs, we have 2 primary hospital networks. In the past, some people have had a very strong opinion about one over the other. More and more plans have started contracting with both hospital networks in our area. But if you have a preference, make sure that you ask the plan which one they participate with. If you have health issues and you see a lot of specialists, some of these plans, like the HMOs, would require that you get a referral from your primary doctor every time you need to see a specialist. And that means you potentially have 2 appointments to make. Every time you want to see a specialist, even if it's the same specialist every 6 months, you'd have to go to that primary care doctor to get that referral to go see the specialist. You may have a copay for that primary doctor. You will absolutely have a higher copay for that specialist. If you're looking at these plans for the extra benefits, the dental and the vision, free gym memberships, those kinds of things, ask the plan specifically what benefits they offer and how those benefits work and how you access them. A lot of people get into these plans for the dental coverage, not realizing that they have to use the dentist that these plans contract with, or the eye providers that these plans contract with, and they can't just go to their dentist and that dentist build this plan. So that's another potential thing to think about. Again, handouts that I sent to you earlier today. This is another handout put out by the Division of Insurance for the SHIP program. This basically is just going to be a handout that kind of goes over everything we just talked about, how the different plans work and what the differences are between HMOs and PPOs and all that kind of good stuff. But I also included this handout. Unfortunately, this handout only applies to El Paso County because I didn't have time to do any of the other counties. But this is basically an at-a-glance handout where I've done a lot of the work for you. And so for El Paso County specifically, I have been able to list all the Advantage plans available for purchase in El Paso County. And I have given you what type of plan it is, whether or not that plan has a premium, what the co-pays are for some of the most basic services with each plan, such as your primary doctor copay, your specialist copay, hospital copay, that kind of stuff. Medicare Advantage plans, because you have out-of-pocket costs in the form of copays, do have maximum out-of-pockets, meaning if you spend X amount of dollars out of your pocket in copays with a plan, if you reach their max out-of-pocket within a year, once you hit that limit, the rest of the year, the plan has to pay 100%. You pay no more copays. But come January 1st, that starts all over. And I've also tried to list what hospital networks each plan participates with. So again, hopefully this is helpful. It's more of an at a glance. It doesn't give you all the information about all the plans, but it gives you a place to start. Again, you can go to the Medicare website, medicare.gov, and use their search engine to look at more specifics of each plan and make sure that those plans cover your drugs. One of the best things about the search engine on the Medicare website is it does allow you to enter all of your specific medications down to quantities and dosages. It even allows you to pick up to 5 preferred pharmacies that you would like to use. And it will base the plan's listing on those preferences and those needs, so that it will list the plans that are going to save you the most money on your prescriptions. And then it goes into detail about what the copays are for each of the plans and what types of plans they are. It is probably the most comprehensive way to look at the plans for both drug coverage and Advantage plans. And we are happy at our office to help anybody walk through that process or go through that process with them on the Medicare website to help them determine what plan they might want to enroll in. During the annual open enrollment period, that's what we spend that 7 weeks doing, is helping people use that plan finder on the Medicare website to determine if they want to switch to a different plan or enroll in a different plan for the next year. All right, so that is Advantage plans. Are there any questions about any of that? Again, if you have a question, you can simply unmute and ask your question, or you're always welcome to type it into the chat box. No questions? All right. Then we will move on and try and wrap it up. So that was Advantage plans in a nutshell. Again, I mentioned briefly last week that there are programs available for people who have limited or low incomes to help with the costs of Medicare. They're called Medicare savings programs. These programs are designed to help cover the costs of Medicare premiums, the Part B premium, as well as Depending on your level of coverage, it may cover some additional costs after Medicare, such as the Medicare deductibles and co-insurances. Unfortunately, I am realizing I haven't updated the slide yet. The 2022 numbers for this program just came out last week. But these are the income and asset limits. Because this is a financial assistance program through the government, there are always going to be income and asset limits you have to be within in order to qualify. If anybody wants any additional information or has questions about the Medicare savings, you're always welcome to call us. We do help with determinations and applications for these programs. Next week, we'll also talk about the other assistance programs, specifically for Part D coverage. But again, any questions or anybody wants additional information about the Medicare savings programs, just let us know and we're happy to help you with that. And I think that is all I have for you tonight. I know that was a lot of information. Hopefully the handouts are helpful. If you have questions, you are always welcome to give us a call. You are always welcome to shoot me an email. Again, if you happen to witness or experience any of those do's and don't things that we talked about for marketing, please let us know. This is the local Medicare, Senior Medicare Patrol Office, which is a part of the SHIP program, but it specifically focuses on Medicare fraud and abuse. I've listed the state, the Colorado State hotline, but again, you're always welcome to call your local SHIP office, which is us. Here's our local number. Here's my email address. If you have any questions, you're always welcome to shoot me an email. You actually probably get a much quicker response if you send me an email versus leaving me a voicemail. I've also listed the statewide number for Colorado. If you call that number, it'll route you to the SHIP office closest to where you're calling from. But we should always have someone available. We currently have 5 full-time counselors and a volunteer. I'm actually going to be losing 2 counselors, but training 2 new ones in the next couple of months, but hopefully also bringing on a couple of new volunteers. So someone should be able to talk to you or return your call in a relatively short amount of time if you have questions. And please let us know if there's any other information we can provide or assist with. And that's all I have for tonight. Hopefully I will see you all next week when we talk about Medicare Part D in great detail. And again, as usual, I will always send you the handouts and the slides before that presentation. Other than that, unless there are any last minute questions, I will let you all go and enjoy the rest of your evening and hope to see you next week. All right. I am not hearing any questions, so I bid you all a good night, and please let us know if there's, oh,